and welcome to #Africa, where we bring you the latest news from across the continent. I'm Ropiwa Madzena. Let's kick off with some of the top stories making headlines this week. Now, at least 95 people have been killed in an attack on a village in Mali. Violence between Dogon hunters and Fulani herders has killed hundreds since January. In March, gunmen killed more than 150 Fulani in one of the worst acts of bloodshed in the country's recent history. President Bakba Keita condemned the killings. United Nations peacekeepers provided their support on Monday as part of the government's attempt to prevent further attacks.
Today said that a deadly attack.
Sudan's opposition plans to nominate 8 members for a transitional government and name a prominent economist to head it. Tensions have soared since the security forces killed dozens of protesters in Khartoum last week. A top U.S. diplomat is expected to head to Sudan this week, calling for a cessation of attacks on civilians. Just last week, Ethiopian Prime Minister Abiy Ahmed visited Khartoum in a bid to mediate. And Pope Francis is also appealing for peace in Sudan. He addressed the conflict in his weekly address to crowds in St. Peter's Square on Sunday.
Che giungono in questi giorni dal Sudan. Preghiamo per questo popolo, perché cessino le violenze e si ricerchi il bene comune nel dialogo.
1 in 4 cases of Ebola goes undetected in the Democratic Republic of Congo. Now, that's according to the World Health Organization. More than 2,000 cases have been recorded since August 2018, and more than 1,300 people have died. This is the second deadliest outbreak of the virus in history. To give us a sense of the situation on the ground, we are joined by Doctors Without Borders' John Johnson. Now, he's the Ebola Emergency Coordinator. John, many thanks for your time. What are we not getting right when it comes to containing the virus? Surely there could have been some lessons learned from previous outbreaks.
Yeah, so there's a lot of challenges responding to this particular outbreak in North Kivu. I think probably the most difficult is generally where we are. When you look at historic Ebola outbreaks, most of them are in secluded villages, and they're relatively easy to respond to and to stop fairly early on. But where we are in North Kivu is a highly densely populated area. You've got large cities like Beni and Butembo with 400,000, 1 million people that live there, and active transmission inside of these cities. On top of that, you're talking about a context with a long history of armed groups and security problems, a long history of fighting and violence, which makes an already fragile system even more fragile when you add an Ebola outbreak on top of that. So there's many confounding factors that make it very difficult to respond in this particular area.
Now, the World Health Organization says these large outbreaks have become sort of the normal in the region. And why are modern outbreaks so much bigger, would you say?
You know, that's a good question. I would say that people have a lot more mobility than they've had in the past. Like I said before, historically, most Ebola outbreaks are in small villages. Nowadays, those small villages, they have the ability to travel to a bigger town, and that's where the Ebola outbreak can spread widely. I think that's going to be what we see more and more in the future as there is more communication between villages and towns. As roads improve, there will be, obviously just more communication between different villages, different towns, different cities, and it's going to be much more difficult to stop these sort of outbreaks from spreading.
Now, you're on the ground there. Talk us through some of the processes that have been put in place to help treat and contain the virus within that particular area.
So the treatment for Ebola, it's based on what's called the 7 pillars. You work on surveillance activities, following contacts of Ebola cases, isolating and treating those Ebola cases in a treatment center. communicating the risks, trying to work on community engagement, getting the community on your side, helping them understand what's happening with the outbreak and how they can protect themselves. It's a big consortium of teams from the World Health Organization, the Ministry of Health, lots of non-governmental organizations. We all have to work together in different areas to be able to stop the outbreak. But this is, like you said, it's the second largest outbreak in history. Getting all of those teams to work together, getting all of those pieces of the puzzle to be able to respond in a way that puts an end to the outbreak is very, very complicated. It's a very complicated job. And you've got, some of the smartest people in the world working on this outbreak, but it's definitely not without its challenges.
No, that's true. And I'm glad you mentioned teams there, because I really wanted to get into this issue of partnerships. You have mentioned partnerships with the government and other non-governmental stakeholders. What about resources outside of the country? Do you find that these are flowing in to help deal with the outbreak?
Well, certainly, I don't think there has been enough international response to this Ebola outbreak. When you look at just the funding is about half met for the needs that have been projected. You look at the number of external actors that are here working, and there's really not a lot of international NGOs that are currently here. There are some notable ones that are working on the outbreak, but again, the response is not nearly as large as it should be for the time. It's 10 months now that we've been going through this outbreak. The time and the scope of this outbreak. We have, like you said, over 2,000 cases, 1,300 deaths. This is a very, very serious, very large outbreak, and the response needs to scale up.
And then just a thought, you mentioned a little earlier about engagements with the community members, but I would assume that those mindsets really need to change of the people that are on the ground there. And in your opinion, just based on those engagements, do you think there's been enough education around the disease? We've heard people call the disease a conspiracy that's been put together by Western forces.
Sure, this is nothing new. In every Ebola outbreak we've ever responded to, you see these types of rumors. It's very normal. Ebola is a highly lethal disease. It's poorly understood. It's not well known in the world, and certainly when you're working in these sort of remote areas, there are lots of rumors that go around. To respond to your question, I think for the most part, people are aware that Ebola exists. I think there's still a lot to discuss with the local communities about what that means and what the response means and how we're responding and how we can work together. And there are plenty of rumors, plenty of misunderstandings, people that think, like you said, maybe there's some sort of conspiracy involved behind the Ebola outbreak, that Ebola is some sort of business or things like that. We're really working on engaging the community in the best way we can to really sort of help them understand how they can protect themselves, how they can work together with us to end the outbreak. And when you look at previous Ebola outbreaks, all of the other activities, case management, surveillance, safe burials, all of those things are important. But what really changes the tide of the epidemic is when the community themselves begin to take charge of the epidemic and to protect themselves and to make sure that the cases stop spreading. That's really when we saw a difference in 2014 in West Africa. And I think that's really what's going to make the difference here, is when the community begins to really work with us on ending the outbreak.
Yeah, that's right. Taking charge of that epidemic, indeed. Thank you for those insights, John. I've been speaking there to Doctors Without Borders' John Johnson. When we return, we are joined by a Sudanese medical doctor and protester for the latest on the unrest in that country. Stay with #Africa.